My name is Nicholas Phillips. I'm an orthopedic upper extremity specialist. I specialize in shoulder, elbow, and hand surgery. I became a doctor because of my interest in science. It started out at a young age. That was always one of my favorite subjects in school, and when going to college, I knew that I wanted to study something in healthcare from some of the experiences that I had playing sports as a youth and suffering injuries and interacting with some of the doctors and physical therapists during that time. So I think with orthopedics, I fit the mold. One of my favorite subjects in medical school is gross anatomy, and then when you go out on your clinical rotations, you have the option to do non-operative and operative rotations, and I always enjoyed the operative rotations more. And then with specifically orthopedics, I had a chance to rotate in that field as well, and I knew it was the right fit for me. Most of my practice, I would say, is traditional hand surgery, wrist form, elbow surgery, but then probably a third of my practice is shoulder surgery. So I do a lot of shoulder replacements. I do rotator cuff repairs, shoulder arthroscopy, fractures of the entire upper extremity, and then a lot of what I do in the hand involves carpal tunnel surgery, trigger fingers, arthritis, nerve injuries, tendon injuries. That's what composes most of my practice. Part of the reason I went into upper extremity is because I feel like it's one of the more rewarding fields of orthopedics because your livelihood is very much dependent upon being able to use your hands and your arms. And a lot of times patients have really debilitating conditions. Doing the shoulder replacement, it drastically improves their shoulder range of motion and kind of restores their life to a much higher quality. So that's been very rewarding. But that's something that I see frequently with shoulder replacements. It's a very gratifying change of life quality procedure. When I was looking at practices across the country, it was a good fit here because you get the opportunity to serve a vast array of patients. We're also involved with Salle University, which is very rewarding for me because I was a Division I athlete and we still interact with the athletes there. Myself, Dr. Kimball, and Dr. Kaplan, we are the team physicians for Salle University. Typically, we're involved with going to their training room once a week, and the athletes come to our office once a week, and then we cover their basketball games, their home basketball games. And it's been great working with a combination of the administration there, the trainers. They've all been great to work with there.